So this is a study that I've quoted many times before in the past to patients and onto blogs alike, and it's basically on tennis elbow. Now obviously I've seen plenty of patients who've had tennis elbow, and the other thing is I've seen plenty of patients who've had tennis elbow and had corticosteroid injections into it as well. The reality is that, you know, in the past a patient would go to a doctor and they'd have tennis elbow and it wasn't getting better. And this could be down to, you know, work-related problems in terms of overload and so on. They would inject it and it would feel better. So they would go away thinking, problem solved, sorted. So they go away and, you know, down the line, problem comes back. GP thinks, well, the steroid injection worked last time, so we'll inject it again. And they do. And then once again, it might be that it's effective. So they go on and carry on, and they keep going round in circles, and each time it's getting worse over time, and they just all assume, everybody, that the injection is good for it and it's just getting worse because of circumstance. Well, even if this was the case, it still wouldn't be the right approach. It's not solving the underlying issue. But the thing is that there's always been this knowledge of steroid having a degenerative effect on tendon and on connective tissue, and that's exactly what this is. You know, tennis elbow is the common extensor tendinopathy, so damage cumulatively over time to that tendon, degeneration therefore. So we've always kind of gone, well, steroid injections might not be great to do many times maybe, but it might, you know, help them to function and get back to normal. And that might still have some truth. There was a research paper done in 2013 though, where they actually did a comparison study over a year. They looked at short-term outcomes and long-term outcomes. They were looking at doing nothing, comparing it to physio, comparing it to the corticosteroid injection. And sure enough, what they found is in the short term, the steroid group had the best effect, the lowest pain levels. So again, this bears truth with what people find in real life. The other two groups, again, not a lot different. A year later, they came back to them and re-examined what was going on, and what they found is that out of all groups, on average, the steroid group were worse. The other two groups, on average, were fine. So this means that basically, even if you just wait and manage symptoms correctly, you can get rid of tennis elbow. If you have physio, you can get rid of tennis elbow. The steroid group, however, were worse. And this is down to that degenerative element. So there's two things. There's the degenerative element of the steroid on the tendon, which obviously is accelerating the problem there. It's getting rid of inflammation, which is what heals the body. So again, it's getting rid of that element. And also it's getting rid of the protective element. So inflammation also carries with it an increase in pain, so a lowering of pain threshold. So again, this means that, you know, you're going to go, instantly feeling better. So that means I'll just instantly start reloading it up again, versus before it was like, I can't do that because it hurts. Well, remembering pain is generally a protective reflex. I know that it can sometimes get out of control, and this is true, but it is not necessarily good in all cases with regards to that. So if you think about it, it makes common sense that you would be worse a year later because you've got rid of any healing capacity. You're now re-overloading it big time without realizing it, and it directly degenerates connective tissue. And until you saw this type of study, you would not have known this. You would have assumed, like the patient and GP in the first analogy, is that you would just think, it worked, but it's just come back, so we'll do it again. So this highlights that steroid injection should not be done routinely for this type of problem. And if it is, it's because the pain levels are so high that it's impeding their ability to train and rehab that tendon. But then it should be something that's a window of opportunity as opposed to a curative element. So you should never just have the injection. You need to inject it, pain drops, you rehab it progressively, you still monitor what you do in the day, and then, like I say, you start to phase that up, and then the injection will wear off, and then you will hopefully have rehabbed the tendon and be feeling pretty good. So anyway, that's it for this one, and I'll see you next time.